Up next are the presentations about the hackathons and Data4Good. And the first presenter is Serge Masyn. He's working at the Global Public Health Department at Johnson & Johnson, where he's supporting the Ebola Deployment project. And Serge is going to talk about Data4Good.
All right. Thank you, Nele, for the introduction. Don't worry about Ebola, by the way. And those of you I shook hands, there's no issue. Nele, Veronique earlier this morning made us afraid. Now I'm going to make you really afraid. So before you run out of the audience here, I would like you to imagine a threat, a risk. Something like car traffic, HIV, or Ebola for that matter. But can you really think of a threat that puts half of the world population at risk? That's more than 3 billion people. If you look at your left and right neighbor, and if you're not at risk, then either one of them is. Oh, this is the threat, by the way. It's not football. This morning we learned that around football we make more car accidents, but it's not football. It's called the dengue virus. It's a viral infection that it affects infants, young children, and adults. And occasionally it develops into lethal complications. There's no specific treatment, only early detection and access to proper medical care such as simple hydration will help you. And prevention and control heavily depends on effective vector control. It's a mosquito-borne viral infection. The mosquitoes are the vectors. And only the female mosquitoes bite. That is probably why I got invited to this ladies-only Data Innovation Summit, by the way. A lot of factors actually influence dengue. Rainfall, stagnant water. It breeds in man-made containers, temperature, and it lives in urban areas. Unlike the malaria mosquito, it bites during the day, so a mosquito net will not help you. Because of its flu-like symptoms, it's often misreported and underclassified. It's endemic in more than 100 countries, and global incidence, meaning the presence of the mosquitoes, is actually growing. That said, it's waiting for all the mosquitoes to come on the screen. I see already a few people start to scratch in the audience, by the way. Too many mosquitoes. Okay. Now, global incidence is growing because of increased global travel. Because of increased global temperature, the mosquito can live in a bigger region in the world, and because of an increased global trading. It's a bit too fast. As an example, I will stick with this one. If you look on the internet, you will find a lot of examples that really will help to predict the next outbreak on dengue and to help people to provide them with dengue alerts. And that is why we want to organize a Data4Good hackathon here at the Data Innovation Hub in partnership with Janssen Pharmaceutica. We want to do this in the fall of 2010. We plan to do this by organizing a kickoff meeting and then let teams work for about a month on preparing the weekend, the hackathon weekend, so that we can bring data together, public data sets and private data sets to generate new insights on the spread of dengue. And help, therefore, understand how this disease progresses or how the mosquitoes progress. So I hope that one day we can stand here and say that basically we've helped preventing dengue. And we've put all the technologies that we've seen this morning and all the platforms and all the brains that are in the room to help preventing dengue fever, but also other diseases such as the Zika virus and the Ebola virus for that matter. So with this, I would like to invite everyone to join us at this hackathon and help conquering these diseases. Thank you very much.